Okay, I'm going to be demonstrating a hemostatic figure of 8 suture. Let's just identify and pretend the bleeding is right here. You first want to go ahead and do pinpoint pressure with a finger. Then you will quickly remove your finger, you will identify the bleeding, and you will grab it with your forceps. Once you have grabbed the tissue that's bleeding with your forceps, you will take your needle and your suture and you will drive it underneath your forceps, exactly where the bleeding is. And there should be no bleeding when you're holding the tissue with your forceps. And then you will drive the needle through and you will bring it out the other side. Now, you will let go of your forceps and you will grab the suture and you will pull it up. When you have pulled it up like this, the bleeding should have stopped. If it hasn't, you probably haven't identified the correct area of the bleeding. And then sometimes even if you haven't identified it, this is where your figure of 8 comes in. You do another suture, almost perpendicular, coming out the other side. Drive your needle through, bring it out the other side, and then you will hold the tail of your suture and bring that through. And then that's where definitely your bleeding should have stopped. And then you will tie this. I'm going to go ahead for demonstration purposes, do an instrument tie. Notice that I did 2 loops onto the needle driver and I will bring it over, and now I'm laying the knot flat. So I'm using my hands to move, and that is a flat knot. And then we go ahead and we will tie this one, and the hands are in opposite directions. And then you're just basically going in opposite directions to lay all of your knots flat. That's how you make sure that you have flat knots. And then usually with about 4 or 5 knots, I'm done. Go ahead and cut your suture. And there, you should have obtained hemostasis. Thank you.